You know, health checkups are super important, especially as we get older, right? But here's the kicker. After 70, some routine tests might actually do more harm than good. Sounds wild, huh? Today, we're diving into 5 specific screenings you might want to think twice about. This isn't about skipping your health, it's about making smarter choices that really work for you. Stick around and let's figure this out together. First up, let's talk about routine mammograms for women over 75. For decades, mammograms have been the gold standard for early breast cancer detection. However, as we age, the benefits can start to diminish. For older women, breast cancers often grow much more slowly. The potential harms of screening, like false positives, can lead to unnecessary anxiety, biopsies, and sometimes even overtreatment of cancers that would never have caused a problem in your lifetime. The US Preventive Services Task Force, a leading panel of experts, doesn't even have a clear recommendation for women over 75 because the evidence of benefit is just not strong enough. So, instead of automatic screening, it's about having a personal conversation with your doctor. Talk about your overall health, your life expectancy, and your personal preferences to decide if continuing mammograms is the right choice for you. Next on our list is routine PSA testing for prostate cancer in men over 70. The PSA test, or prostate-specific antigen test, has been a topic of debate for years. While it can detect prostate cancer early, it has a high rate of false positives. This often leads to a cascade of further tests, including painful biopsies, which carry risks of infection and other complications. Many prostate cancers found through PSA screening are slow-growing and may never pose a threat. Treating these can lead to serious side effects like incontinence and erectile dysfunction, significantly impacting quality of life. For men over 70, many medical organizations suggest that the potential harms of routine screening outweigh the benefits. Again, this is a personal decision to be made with your healthcare provider, weighing your individual risk factors and health status. Third, let's discuss routine colonoscopies for people over 75. Colonoscopies are fantastic for finding and preventing colorectal cancer, and they're highly recommended for people between 45 and 75. But after 75, the picture changes. The preparation for a colonoscopy can be very tough on an older body, sometimes causing dehydration and electrolyte imbalances. The procedure itself, while generally safe, carries a slightly higher risk of complications, like bowel perforation, in older adults. If you've had regular negative colonoscopies your whole life, your risk of developing a new, aggressive cancer is quite low. So, if you're over 75 and in good health, discuss with your doctor whether another colonoscopy is truly necessary, especially if your previous tests have all been clear. It might be time to stop. The fourth checkup to be cautious about is routine blood sugar screening for diabetes in adults without symptoms. Now, this one might be surprising. Of course, managing diabetes is critical, but we're talking about screening people who feel perfectly fine. For older adults, the definition of high blood sugar can be a bit more flexible. Aggressively treating slightly elevated blood sugar levels can lead to hypoglycemia, or low blood sugar, which is incredibly dangerous for seniors. It can cause confusion, falls, and even loss of consciousness. The risks of overtreatment can sometimes be more immediate and severe than the long-term complications of very mild, asymptomatic high blood sugar. The focus should be on a healthy lifestyle and only screening or treating when there are clear symptoms or higher risk factors involved. Finally, number 5. Bone density scans, or DEXA scans, for women over 65 who have already been treated for osteoporosis or have a very low risk. While these scans are important for initially diagnosing osteoporosis, repeating them too frequently often doesn't change the treatment plan. If a woman is already on medication for bone health and is taking precautions like getting enough calcium and vitamin D, another scan in a year or two is unlikely to provide new, useful information. It can lead to unnecessary worry, and in some cases, pushes for more aggressive medications with their own side effects. The better approach is to focus on fall prevention, which is the #1 cause of fractures in older adults, and to stick with the treatment plan your doctor has already laid out. So there you have it, 5 health checkups that might not be as helpful after 70 as you think. The key takeaway here is not to skip doctor visits, but to become an active partner in your healthcare. Ask questions. Discuss the pros and cons of every test. Your health journey in your 70s and beyond should be about quality of life, not just quantity of tests. It's about personalized medicine. Thanks so much for watching today. I hope this information empowers you to have more productive conversations with your doctor. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more senior health tips. Stay healthy, stay informed, and we'll see you in the next video.